Thalassemias is a group of blood disorders, and there are so many different types of blood disorders. So specifically, looking at beta thalassemia major, it's a blood disorder that is inherited by genetics. So if a father and a mother both have thalassemia minor, that is another form of blood disorder, but it is less severe than having a major. But if both parents have minor, then they can possibly have a child who has thalassemia major. And now thalassemia major requires iron chelation therapy, meaning they need medicine to get rid of extra iron in their body, because iron in the body can affect their performance and their functions, and it could possibly harm the patient. And also they need to take regular blood transfusions. Blood transfusions probably takes about a full day, and depending on how much hemoglobin the patient has, they need a certain amount of blood. So each time a patient goes to the hospital, they need about 2 or 3 bags. So that is why it's very important to donate blood. Hi, I'm going to show you how to do a blood transfusion. So usually for patients, you're going to try to find a good vein on either this arm or this arm. And sometimes a patient has good veins here or here. And so what we'll do first is that you're going to tap over here, you're going to look around, and it looks like a really good strong vein here. So what a nurse would do is kind of wrap around this arm and get her alcohol wipe
or his alcohol wipe.
Or his, I'm sorry. There are male nurses. Don't be discouraged.
Don't be sexist.
And you're going to wipe this area. Now, of course, you're going to have the correct needles and everything beforehand. So, of course, the nurse would conduct their IV. And what it is with the IV is that they're taking blood from the patient, so that way the blood can go back to the labs and they can check for antibodies, because if you give the patient the wrong type of blood, the patient can fall ill and it's not good. So you have to be really, really careful with what blood you give the patient, especially with a special disease like beta thalassemia major. So most patients are B positive or O, or there's a lot of different blood types. So it's great to donate today and you can save a life. So that'd be great.
Okay,
Thank you. So earlier I showed you how a patient with beta thalassemia major gets an IV. And of course, male and female nurses has to have the correct dosage and the correct amount of tubes and needles ahead of time, and alcohol wipes and all that stuff. And now after the blood gets to the lab, what happens is that the patient has to wait for their blood to come in. And usually blood transfusions are about 3 hours long each bag. Not each bag, but like transfusions last almost a whole day, depending on how serious the disease is. Now, after a transfusion, the patient has to be careful of signs. So, for example, if the patient cannot breathe, the patient has to call 911 right away. If the patient has hives or rashes, then they have to go ahead and take Benadryl and then call the hospital. And this is an example of what would happen if a patient doesn't get the right amount of blood, or they get the wrong type of blood. So if you donate today, you can save lives.